Welcome to today's ISNTD Connect webinar. It's lovely to see everyone tuning in today. A very warm welcome to anyone who's new to the format. My name's Marianne Comperet, and I'm speaking from the International Society for Neglected Tropical Diseases. We're based here in London, and we hope that everyone's doing really, really well. This week has seen a bit of easing in some countries' lockdown, so best wishes to all of those who are adjusting to again this new phase. It's my absolute pleasure today to welcome Dr. Somia Iqtadar. Hi, Somia.
Hello, thank you for giving me the opportunity to speak at this August forum.
It's absolutely our pleasure. And Somia, you're tuning in from Lahore in Pakistan. Dr. Somia, you are a clinician and you are heavily involved in dengue management and response, amongst many other things. Dr. Somia Iqtadar is chairperson of the Dengue Expert Advisory Group, or is also working with the government of Punjab in Pakistan, and also you are associate professor at the King Edward Medical University in Lahore. One thing that's been really at the forefront of discussions and strategies to cope with COVID-19 is the realization that rapid and tailored response to any form of outbreak is crucial, not just to save lives, but in fact to protect entire health systems. And this is something that you've had a lot of experience in. Pakistan has suffered quite a few regular and severe dengue outbreaks, affecting at times up to 600,000 people, such as in the 2011 outbreak. You've led actually a fantastic response to this and rewriting some of the protocols on what to do in this case. And we thought it would be very valuable to hear from you about all this experience, not just in terms of dengue management, but also on a broader level to see how we can best respond to outbreaks and protect our health systems. So it's our pleasure to welcome you, Somia, and without any further ado, I'll hand over to you for your presentation. And we look forward to also having the opportunity to ask you questions and discuss these issues later on in the Q&A. And to all our attendees, I think many of you are familiar with this, but we do have a chat function where you can type up your questions and your comments for Somia, and I look forward to catching up with you all in a few moments. Thank you. Over to you, Somia.
Thank you very much. I think it's a great opportunity to share the experiences over here on this forum of ISNTD. We all know about this small mosquito, which is, bugging around and causing a lot of disease all over the world. And we all know that dengue has been a threat to the world for the past many decades. And about 7 million people worldwide are at risk of dengue infection, and the disease has grown in its frequency and magnitude with increasing number of individuals in the urban, tropical and subtropical regions affected by this deadly disease. If I talk about the global scenario, in the past few years, the number of cases of dengue have increased many-fold. And if I compare the last 2 years, that is 2019 and 2018, you would see that there was a surge in the number of cases worldwide. And the cases almost doubled from the previous year in 2019. And unfortunately, still to date, we lose many precious lives because of this tropical viral disease, dengue. And we lose about 25,000 precious lives annually because of this disease. So anybody who knows what is the largest dengue epidemic of the world? So sadly, it has been here where I live, in Lahore, which is the capital of Punjab, which is the biggest province of Pakistan. And we had in 2011 the worst ever epidemic reported in the world's history, with about 600,000 suspected cases, 22,000 lab confirmed cases, and we lost 375 people in a very short span of 73 days. So with this emerging disease, which was new to us, and we did not have any previous experience of coping the outbreak of this disease, which was not known to us, all efforts were based on simple mosquito control. And this was the state of affairs of our teaching or tertiary care hospitals in the city of Lahore, where there was a long queue of people suffering from fever and body aches and pains, and sometimes with bleeding, and they wanted to get their self checked whether they are suffering from this new disease which they didn't hear of before. And this was the state of affairs in the hospital, where all the beds were occupied by patients of dengue, and we had to convert our hospitals into dengue hospitals because such was the burden of the disease. It's then we joined hands together and we thought that we should do something about this. You all know that Pakistan is an underdeveloped country, and in this developing world, we had this new threat of this new disease, and we were not aware what to do, and all the efforts were on the based on the mosquito control only. Then we gathered knowledge about it, and then we sought some help from our international experts. And Alhamdulillah, by the grace of Allah, now today we stand at a point when where we have an effective dengue control program in Pakistan, and particularly if I talk about province Punjab, in which I am looking after these affairs. So the combating of the dengue outbreak made us learn a lot, and the lessons from dengue control in Pakistan I will be sharing with you in this webinar today. Pakistan, if you know, is an Asian country which is located in the Southeast Asia, and we have a beautiful geography, and we are blessed with all the four seasons, which are very warm in the summers and very cold in the winters, and with moderate temperature in the region. Which is not mountain but plain, usually between the months of March, April, which is a temperate climate, and then again in the July, end of July, August, September, and October, which is the post-monsoon period. So the Pakistan, all the provinces of the Pakistan, they've been having. There was a glitch. I was talking about you that what are the lessons that we have learned from our experience of handling dengue. So we took few steps which have helped us in combating this disease in our part of the world. And the steps that were taken, I'm going to share with you one by one. The first step was because we were new to this disease and we didn't have much knowledge. So we engaged in conversation and discussion with a lot of international experts, and we had collaborative meetings with them so that we could know in detail what are different modalities that they are adopting to combat this disease. And you know, because dengue is prevalent mostly in the Southeast Asian region. So in this tropical belt, we had experts from Singapore, from Malaysia, from Indonesia, from Thailand, and Sri Lanka, and they helped us a lot in developing our dengue control program here in Pakistan. And we had the field visits, the hospital visits, and meetings and discussions, and then we were able to identify what are the problems that we need to address, and then we structurized our dengue control program. But I think the main thing which helped us in developing a successful dengue control program was the advocacy and the political commitment, which is shown from the highest level from day one. We have a central emergency response committee in which the meetings are chaired by the chief minister. We have town emergency response committees and prevention and control program of epidemics in Punjab that we have recently launched. We were fortunate enough that a group of experts consisting of 100 different people, some of which were clinicians, some were virologists, some were pathologists, some were blood transfusion, some nurses, environmental specialists, and administrative people. They were sent on a 3 weeks training program to Sri Lanka and Thailand, and this was Dengue Epidemic Prevention, Control and Management Program, which was the initiative of Government of Punjab, and along with the Royal Thai Government, the Sri Lanka Ministry of Health Epidemiology Unit, and the Asian Institute of Technology, Bangkok. We were trained there for a period of 3 weeks, and then the master trainers were appointed, who then delivered the training session. At the same time, the Dengue Expert Advisory Group was formed, which is a body which provides clinical advice to the policymakers and develops algorithms and treatment modules for clinicians who are working in this field. And I'm very honored to be chairing this Dengue Expert Advisory Group since last year. We have developed some reporting forms which are used by our clinicians in the hospital settings. These are forms O and form R. Form O is the outpatient reporting form, and form R is the indoor reporting form. They are color coded, and they address the different things with which the patient can present to you in the hospital, including the headache, retroorbital pain, rash, myalgias, arthalgias, the symptomatology, then what is the vital statistics of the patient. They are also recorded, what are the lab values, and if there are any warning signs. And this is how we catch the patients in our reporting system. This is the design of the dengue counter that we have established in our hospitals, so that a person comes to the hospital and under a single roof, in one room, all of the tests they are done. The patient's blood sample is drawn, his forms are filled, his reports are conveyed to the doctor. The whole of the data goes into the data entry dashboard, and from there the patient is facilitated whether he needs admission, or if he is discharged, then he is given an information brochure and asked to follow up in the next day. We have developed some documents for teaching and training, and for develop good clinical practice guidelines for the doctors. We are recently developing our dengue GCP guidelines in pregnancy with the help of our gynecology experts. Then we have an extensive training program on the clinical management, because you know that the whole duty of treating these dengue patients lies with the clinicians and the medical experts. So we train them in sessions, and these sessions are carried out every 3 months on a bigger scale, and in all the teaching institutions, medical teaching institutions of Punjab, we carry out these sessions, clinical management, which are certified training courses, and then these people, they treat the dengue patients in their respective hospitals. These are some of the snaps from different sessions that we have carried over the last 9 years in different parts of Punjab. Then I want to tell you about different initiatives that have taken place. We have also established a Punjab Healthline. We have a vector surveillance system in place since January 2012. We have a dengue tracking system. We have a patient reporting system. And recently we have developed an application for reporting of the patients from the general practitioners or private sector hospitals of a smaller setting. The dengue tracking system, it works in 36 different districts. There are 27 different departments which are engaged in this. There are 37 million activities recorded on this system, and there are about 9,000 plus Android users which identify what are the hotspots in the community, and they do surveillance in these systems, and they are all recorded in a dashboard via the smart application, which is the dengue tracking system. We also have a patient reporting system which is given to 200 plus government hospitals and major private hospitals, and now we have added this another application for the general practitioners, where we are launching next week. We also have a health complaint management system and helpline, and dengue virus reports, they are addressed, and complaints from the public are addressed in these systems. The vector surveillance system is divided into an indoor surveillance and outdoor surveillance system, in which the field workers, the dengue teams, they go out for surveillance in the indoor as well as outdoor, and record their findings in the form of pictures, which are then uploaded on this dashboard. And after doing the needful, that is, if there is drainage of water required, they drain water, and a before and a after picture that is uploaded on the dashboard. Then there is a disease surveillance system, in which the data comes from many sources, including the public and private hospitals. Also, we have included the public labs and the private labs who are testing these patients. They also enter their results on this online patient reporting system, and then this data is analyzed and used for further workup. So this is the dengue patient information relaying system or disease reporting system, which is placed in all the hospitals. And in the patient reporting system, patients' demographics, workplace, occupation, clinical information, lab information, and outcome and diagnosis of the patient, they are all entered. And the epidemiological report, line listing of each patient is maintained through this system. Dengue patients, the daily SMS of dengue patients is sent to all the stakeholders. The details are given district-wise. It is sent to the advisor, to the health, secretary health, minister of health, DCOs, and all the DAG members for necessary action. We also have a patient entry on portal. Patient tagging is done through this, and then accordingly the case response is then. done in the areas from where the cases are being reported. By case response, I mean that the Dengue team goes over there at that given address and it does indoor surveillance and outdoor surveillance in that area and see if there are any other patients or if there are mosquito conducive environment, and they remove if there is any stagnant water or any hotspots. And this is also then captured in the dashboard in the form of before and after pictures. So the patient entry, tagging, and the case response. This is the whole circle which eases out our dengue control program, that when we ever get a patient, the patient's address is tagged, the team goes there, finds out what is wrong over there, and it not only checks the house from which the patient is reported, but 49 houses they are screened. One house is the central house, 12 in the front, 12 at the back, 12 at the right, and 12 at the left. They all are screened for the presence of mosquito and larva, and corrective measures are taken. We also have a dengue monitoring cell operational, and they generate alerts. The alerts are for vector alerts as well as the disease alerts. There are three types of alerts that are generated: vector-based alerts, WHO-based alerts, and GIE-based alerts. For the vector-based alerts, we have a BRATU index as our marker. The BRATU index is more than 3% in the indoor, then the vector alerts are generated, and this alerts the marks of the beginning of the potential dengue season. And this monitoring cell, it works 24 hours 7 during the dengue outbreak. The case response, I've already explained it to you in detail, that when the patient is reported in the system, then the team is mobilized to their house, the case response is done, and the whole of the activity is recorded on the dashboard. Talking about the alert thresholds, we have alert thresholds and an outbreak threshold, which are practiced in our part of the world. We have also developed GIS-based alerts, and we have also developed a new system recently in which we divide our areas into red, green, and yellow zones. Green are where there are no larva and no patients. Yellow are where there is larva present, but there are no patients reported from that area. And the red is where there are larva and patients both reported. So based on this red, yellow, and green, we devise our dengue control program, how much HR we need to engage, and what is the level of activity that is required in these zones, and how frequently we need to visit these places to do the surveillance activities. We also have a SAT scan alert as a prediction model, and it depends upon the positive larva and the weather data. We have in place a surveillance and a monitoring system which is monitored by the highest level. There's a Central Emergency Response Committee, and the meetings are chaired by Chief Minister and the Minister of Health, and under them are the Town Emergency Response Committee. Last year, we have introduced this third-party validation application so that you can check whatever this is entered into the system. We do an audit, and an audit report is generated. So activity is reported, there is spot checking, there is third-party review, and on the basis of this third party, the corrective measures, if there are any problems, they are identified and the control mechanism comes into place. We also publish the weekly bulletins, which are dengue, in which the dengue is specifically focused, and all 36 districts they report different diseases, and dengue is part of the disease reporting system. And we publish this weekly bulletin, which is then shared with all the districts and the health professionals and the policy makers. We have a health complaint management system in place, which is a Punjab Health Helpline, and we get complaints on this, and the pendency of these reports, this is checked, and it has to be resolved within a short span of time. And if there are some reports which are pending, then in the cabinet committee meeting we discuss about them and why are they not resolved in time. This is taken into account. We also have started a mass awareness campaign, which includes all the mediums of the communication that you can think of, like social media campaigns, like print media, electronic media. We have pamphlet distributions, we have walks, we have painting competitions, then we do TV programs for patient awareness and for general public awareness. And this is all done through a very, very organized media campaign, which is managed by our health department, and all different sectors of the population, including the school children, teachers, the general public, women, workers in the field, they are all addressed by using the social media. And if I share with you the impact of all these measures that we have taken in the past few years, we have seen that they have been very meaningful. And this is depicted by the fact that we globally know that annually approximately 2.5% is the case fatality rate of dengue. But in Pakistan, we started with a high case fatality rate, but we have overcome the problem of clinical management and dengue surveillance, and now we have been able to curtail and bring down the rate of dying people dying of dengue to 0.004, which is very, very remarkable, I think. Last year, we had an international conference on dengue in 2020, where we invited experts from different parts of the world. ISNTD also was part of it, and we developed our guidelines, and we had 7 thematic areas, including the clinical management, the vector surveillance, the communication and strategy, the social mobilization, the lab protocols, the cross-cutting IT analytics. And this was all addressed in small group discussions. And then this 3 days conference was very well appreciated at all international forums, and it helped us a lot in improving our existing dengue control program. I was very honored to represent Dengue Expert Advisory Group in Pakistan in ISNTD Festival in March this year, where the dengue activity tracking system was awarded the winner of the application award this year. So I'm really thankful to all of you for joining us today and seeing dengue control program from the Pakistani perspective. And thank you very much. If you want to get in touch with us, these are our website address and our email addresses, and I will be happy to take any further questions on this. Thank you very much.
Thank you so much, Somia, and delighted that we made it in one go to the end. So I really apologize if that was in any way stressful for yourself. Thank you so much for this overview. I think we did, as you said, we did give the app one of our awards at our ISNTD festival. This is something that we put on once a year to kind of bring together a lot of creative approaches to public health and disease control, and the app seemed to really tick absolutely all those boxes, being multi-sectoral, being very, easy to use platform, also bearing in mind a lot of community engagement. So really kind of a complete 360 approach to disease control. So that was just definitely a well-earned award, and it's lovely to have the opportunity to see you again. I think when we met in March, things were very different, and here we are a few months down the line. And so one of the first comments actually that came out of your presentation, Somia, we've got here a question from. It's all the way at the start, sorry. Yes, okay, so a question from Asghar Talbalagi, who's asking, how will you manage things differently this year with COVID-19? Of course, the burning question.
Yeah, you know that Pakistan is also hit by COVID-19, and especially in Punjab, we have the highest burden of the disease over here. Because Punjab is the most populous province of Pakistan, so obviously the chances of getting infected are more as compared to the other provinces. In the recent scenario, we are not getting many dengue cases as it now. Maybe because I can say the healthcare system is more diverted towards COVID-19 and the reporting system is a bit lacking. But we are finding it really challenging because, because of the COVID-19 pandemic situation, we also had a lockdown for a few weeks, and we could not send out our dengue teams for surveillance, which is home-to-home surveillance. But we have resumed our dengue activities again, and now the surveillance reports they are also coming. We have few cases of dengue in the earlier part of this year, which was in January and February. But the first case of COVID in Pakistan appeared on 26th of February. So after that, we have few suspected and probable cases and only 2 confirmed cases till date. But we are just looking how the things go, and it is very challenging, we know, but we are on our toes and devising a mechanism that how we can efficiently work on the dengue surveillance and reduce the number of cases and prevent the dengue before it comes to the hospitals. And then also we have a challenge, in the diagnosis of dengue in the setting of the COVID. But at the moment, we are not doing antibody testing for COVID. We are only doing RT-PCR for patients. So I don't think that there is any chances of cross-infectivity or false positive results because PCR is quite sensitive and a specific test for COVID as well as dengue. So I hope the things go smooth and we will be able to manage this situation.
Brilliant. And that actually touches on a question that was posted here by Helena Liartha. Helena is with the Ministry of Health Indonesia and was asking about that. Do you have false positive case dengue during COVID-19? Because both cases have similar presentation in early stage.
So as I told you, that we have a similar presentation clinical, but we always go for an RT-PCR for COVID, and so there are less chances of false positivity.
Right, and if anybody would like to find out more about this, this issue was our very first ISNTD Connect webinar, and the clinician Dr. Gabriel Yan from Singapore gave a full presentation on this exact topic. So if you would like to find out more and in fact review any of our past meetings, please go to our YouTube channel and subscribe, and we've got all the recordings there for yourselves to review. Quite a few of our attendees, Somia, are asking about dengue in Africa, across the African continent. First of all, whether and obviously you've had a very international and collaborative approach, and whether you connections with dengue control across Africa, and also a really interesting question here from Amadou Wori Jallo, who's tuning in from the Gambia, and who writes, I noticed that Senegal is seeing dengue cases, but this is not the case for the Gambia. And if I may ask, looking at the geographical location of the Gambia, which is, as we all know, completely enclosed by Senegal, I want to ask, what is the best suggestion as to what advice will be given to the Gambia for dengue surveillance?
I think you are not getting cases maybe because you are not looking for them. So dengue surveillance should be, in place. If you have cases from the adjoining areas, obviously the mosquito, is mobile and it can fly and carry the vector to your nearby areas as well. I think the surveillance activities should continue. You should look at the larvae. You can also do the larval sampling if they are infected by the viruses. There are some rapid kits which if you just crush the mosquito, they can pick up if they are infected by the dengue virus, or you can do a PCR of the larva which can tell you if these larvae of mosquitoes, they are infected. So there are many tools, but I think the surveillance should be enhanced. And also the catching of the patients in the hospitals, the patients who come to the fever clinics with typical symptoms of high-grade fever, body aches and pains, rash, and with thrombocytopenia and leukopenia, they should be investigated for dengue apart from other viral illnesses, and maybe then you can be able to correctly find out if you actually do not have dengue or you're just missing out on them.
Absolutely. That's a very good point. There's quite a few questions now coming in, and a lot of thank yous, Somia, for this excellent presentation. An interesting comment here by Emmanuel Agunloye. Emmanuel, I'm not sure which organization you're tuning in from, but just to summarize, Emmanuel's commenting on the fact that in Nigeria in the 60s and the 70s, sanitary inspectors enforced the elimination of mosquitoes. And it seems that now we are moving more towards such as distributing insecticide nets and so forth, and overall health inspectors to increase surveillance, advocacy, and enforcement towards the eradication of mosquitoes has perhaps declined compared to other interventions. And do you think, Somia, that this is perhaps part of the reason why there's been an increase in dengue outbreaks? And is there really a gap there in capacity and in skilled professionals who can undertake this mosquito control? What can we do about building capacity to have the right professionals to
Yeah,
go into?
maybe there is lack of professionals, but we do carry out the training of our field teams as well in identifying of the mosquito and identifying of the larva, because there are different species of mosquitoes and there are different species, there are differences in the larva. So what are the different stages of the larva, to which species do they belong, are they actually and Aedes mosquitoes larvae. So we train them, and then we have this toolkit for them, which we provide them so that they can, do their surveillance, and we provide them with information brochures which they can hand over to the public when they go there, and also teach them how to do surveillance, and they give a checklist to the members of that house, that they do the checklist weekly, and then they compare their checklist with their checklist. So we have developed some modules for training of these field teams and health inspectors to increase the surveillance and enforcement towards the eradication of mosquito and larvae.
Brilliant. And Dora Rajonson, sorry, hi Dora, is asking, during which part of the year do you start to do dengue surveillance in Pakistan?
Dengue surveillance in Pakistan, by book, if I say, is all year round, but we enhance our activities during March and April, which is the dengue season. And then after the monsoon, there are a number of cases, so we start in July and August. This is the most enhanced activity of the dengue program that we have. But the dengue surveillance, it goes on all year round, because we've seen dengue in the coldest of the weather in November and December, which are the winter. We've seen dengue in those months as well. There are some traveler or imported cases. So we do a surveillance all year round, but they are enhanced during February, March, April, and then in August to October and November.
Brilliant. And just going back to the app for a moment, John Gibb, hi John, who's tuning in from the UK, is asking who is responsible for the third-party validation and what happens to those reports. And just before you answer, Somia, we do have a request to speak here. Someone's being very brave, Katia Tejera Marquez. And so I might invite you in to join, Katia. I'm just giving you a little heads up while Somia answers the previous question.
Okay. Regarding the third party validation, it is generally done by the administrative people of the department, and at the district or the city level, it is done by the district or the city commissioners. So they look at, and at the departmental level, by the departmental heads. So in our application, we have different departments, like we have environment department, we have waste management department, we have water and sanitation department, we have labor department. So every department is given a different task. So it is not only health and environment which is handling the dengue, but the labor department, irrigation departments, there are multiple departments they are involved in this dengue control program. They not only do their housekeeping, like keeping their premises free of dengue, but they have been assigned different tasks. But at the district level, the district commissioners, they look at the dashboard in their meetings, which is daily evening meeting during the dengue season and twice weekly during the lean period, in which they validate this information. For example, if a field officer has said that we went to that place and there was water collected in that area, and then he puts up a picture after clearing that water. So he actually looks up at the data and validates whether the picture before and after matches. And sometimes he even sends his team to verify if it was done in the right place. So that is how the third party validation is done by the district commissioners in their evening meetings.
Brilliant. Thank you, Somia. And sorry, Stephen, you've posted this comment a few times. It's really important, so I will just broadcast this to the room. Stephen Bramer who works in pest control, was just flagging some recent research, which I think was published in PLOS, and it's researchers at Vanderbilt University who have found an antibody that can bind all four dengue serotypes and prevent them from infecting new cells. So is this something, Somia, that you are looking into or following up on?
Giving them the ability to make one of these immune proteins combat the kind of infection that you may get across.
Thank you, Stephen, for sharing that with us.
Thank you, Stephen. I am not aware of this research, but I will look into it and I will get back to you on this.
In any case, thank you, Stephen, for sharing that with all of us. And in the meantime, Katya's joined us. Hello, Katya.
Hello, Mariam.
Hi.
Hello,
Welcome.
Professor Sonia. Thank you. Sorry. Internet is quite bad today. Sorry for that.
There you go. It's a global thing. Katya, where are you speaking from?
Well, my name is Katia Marquez. I'm a Aedes aegypti researcher. I'm now a technical advisor for the entomology for the PMI VectorLink project in Angola. And thank you very much for the invite for this conference. And Professor Somia, I would like your help and suggestions for a topic, because here in Angola we had the yellow fever outbreak in 2015, 2016, and we are a malaria endemic country. I don't know if you are aware of Angola's situation, but even if you go outside of Luanda, that is the main city, if we go to the province, we have a very low testing capacity for dengue, malaria, and any other vector-borne disease. And at this point, we have COVID-19, we have local transmission already, and we are putting a lot of efforts for the COVID-19. And I'm quite concerned because we have several gaps. For example, normally our vector control is only for Anopheles. We don't have vector control for Aedes, for example, and the differential diagnosis is quite hard, and we have a very low testing capacity. My question for you is, what you think that should be the approach to try to prevent, for example, a dengue, a malaria, and chikungunya outbreak? Because normally our vector control actions, they are not very consistent, but now with COVID-19, all the efforts are for COVID-19.
Thank you very much. I think that the efforts need to be made, obviously, if we want to control and prevent any disease. So there's no compromise on vector surveillance unless and until we do the vector surveillance and find the challenging time of COVID-19. But at the same time, the other vector-borne diseases, other viral diseases, other infectious diseases, they should not be forgotten. However, we are focusing on COVID-19 these days, but in the background, all the activity which is related to the disease surveillance, which should continue, and only then we will be able to, prevent these diseases and minimize the burden of the disease in our part of the world.
Thank you. Because, for example, in some province, we have a serious increase of malaria and dengue cases. And I'm not quite sure that is very accurate. And I'll tell you why. Because, for example, in the province, in a lot of provinces, even to test for malaria is a big issue. For dengue and chikungunya, the testing is existent. And COVID and all these diseases, they have very similar symptoms at the stage. So we don't even know if there is really an outbreak of any of these three diseases because the data is not that reliable.
Yeah, I know that there is challenging to find testing facilities in some parts of the world, but I think for malarial parasite we have a very simple test which you can just make an empty slide and look at under the microscope for the presence of malarial parasite. And for dengue, even if you don't have a testing facility, the clinical features, they help you a lot. That if a patient is suffering from high-grade fever along with body aches and pains, myalgias, arthralgias, rash, characteristic retroorbital pain. You have a high index of suspicion, especially if your environment is conducive for mosquito breeding, like it is for malaria as well. And a simple, complete blood count, which will give you an idea if this patient is of dengue. Like if you have a cell count of WBC less than 4,000, or a platelet count has a falling trend and is decreasing to less than 100,000, and if the patient is developing any signs of bleeding, they give you a clue that this patient might be of a hemorrhagic fever, and most likely if it is mosquito related dengue. So I think you don't always need a very advanced test like an RT-PCR or even antibodies. You can have a high index of suspicion on the clinical features and a simple test like CBC as well.
Thank you very much, Dr. Somia and Mariam.
Thank you very much, Katya. And by all means, definitely keep in touch if you have any further questions for Dr. Somia. Thank you for that. In the meantime, Somia, we've had a couple comments and questions here. One of them is from, well, it says here, Michael McAcanold, and is this Michael? Maybe you're Michael McDonald. I'm not sure. But Somia, did you mention? Well, what are your thoughts on Aedes insecticide resistance? And by the way, Michael's just saying that he did his doctoral work on Anopheles at the ICMRT Lahore in 1985.
Okay, thank you. Since I'm a clinician, I do not look after the entomology side, but since I'm working in the dengue control program, so I get the reports. We have tested for mosquito resistant in Pakistan with different insecticides. So far, we do not have a mosquito resistance here in Pakistan with the insecticides that we are using. But obviously, we keep on testing every year, and in the light of the data which is available, we change our insecticide regime.
Brilliant. And building on that, Adil Bhatti is also commenting that since 2011, what's been done to evaluate insecticide resistance in the vector? Is there any vector control strategy that is looking into this issue, and what's being done to ensure that this should be avoided?
Yes, we do have, as I already mentioned, we do have an insecticide department. We have entomologists working with us, which check for insecticide resistance. There are many post-doctoral fellowships that people are doing on this subject. There is insecticide resistance in mosquitoes, and we share this data with our universities, like the universities who are of agriculture, because basically they are dealing with this, and the data, in the light of the data, then they advise us which insecticide to use for this reason, and we are working on it.
Thank you. I can hear in the background, it's the call to prayer, and plus you have a packed day as a clinician coping with COVID and dengue. So I'm sure you've given us already an hour of your time. We're very grateful. Somia, I was wondering whether you might have time for one last question and comment. Sure. One or two more. Thank you. It's lovely to have attending this webinar. I'd like to say hello to Hasita Tisera. Dr. Tisera,
how are you?
You know each other well. Dr. Tisera is with
He's
the...
been very helpful and instrumental in developing the dengue control program of Pakistan, and had been a great, very good friend and a great help.
This is clearly a wonderful mutual kind of partnership, because that's pretty much what Dr. Tisera has been saying on the chat about you, Somia, saying heartening to see Somia is taking dengue battle beyond Lahore, Pakistan. Just to note that we may need proactive care pathway for patients presenting with fever, common to both dengue and COVID-19, and also co-infection will be challenging clinical settings. And both Hasita and Somia, you are both on our dengue advisory board. So it's lovely to have you both here. And one of the projects we are working on is just kind of building on the momentum for advocacy and awareness around dengue fever. Obviously, this year, a lot of attention has, all eyes are on COVID-19. But as we move into dengue season again, I think the one message we can take from all these outbreaks is, be prepared for them, but also stay prepared for all the disease across all the health systems. So if anybody would like to find out more about the World Dengue Day campaign and also the other members of our dengue advisory group, then please don't hesitate to hop over to our website, isntd.org, where there's a lot of information there. So a very interesting comment here from Hasitha Tissera. We also had a question from Selvi Subramaniam. Just to round off, what is the predominant dengue serotype in Pakistan, and what is the dengue scenario like at the present moment after 9 years of the outbreak in Pakistan? I think you touched on some parts of that in your presentation.
Thank you, Selvi, for your question. The predominant serotype has been serotype 2, and in recent years we also have serotype 3. But we also have cases of 1 and 4. But if you talk about one predominant one, that is dengue serotype 2. And the dengue scenario in the present moment is that we had a huge outbreak in 2011. We have a little less number of cases in 2012-13, but in 2015 again we had a huge outbreak, and last year 2019 was a very, very bad outbreak. It was there was a surge in number of cases globally as well, and this was reflected in Pakistan as well, and particularly in our province. And we had a huge outbreak, and as I told you, we had more than 8,000 cases reported from our province, Punjab.
Brilliant, very interesting. Just to finish off, Somia, I wanted to ask you perhaps any last thoughts on, what you would like to see ideally in terms of next steps. A few of our attendees have been asking about maybe diagnostics tools, or in an ideal world, having kind of been on the front line of, dengue surveillance, case management, etc. What would be your best wishes that you would like to see happen, whether nationally in Pakistan or even on an international kind of platform?
Yeah, I always say that the only predictable thing about dengue is that it is very unpredictable. Always when we think that we have the things are in our hand and are in our control, then the dengue virus, it resurges. Same was the case in other parts of the world. Like in Singapore, you saw that there was a very huge outbreak. In Philippines, we had a very huge outbreak, and dengue had been there for the past many decades. It was new to Pakistan. We've only been 9 years that we are facing this problem, and we were quite comfortable with the control of dengue for the last few years. But in 2019, it told us that even without the serotype switch, we had a large number of cases and large number of serious dengue illness, severe dengue illness, DHF. So the only thing which is predictable with dengue is it is unpredictable. So we have to be on our foot. The efforts should carry on all year round. It is no more a seasonal disease. I've seen dengue cases in the hottest of the weathers. I've seen dengue cases on the cold mountains. I have seen dengue cases in children, in adults, in pregnant females, in older age group, and it just can vary from a very, very mild illness or an asymptomatic infection to a very severe devastating illness. So I think this is the fastest growing mosquito-borne tropical viral illness, and we've been seeing this in different parts of the world, and it is not limited only to tropics and subtropics now, but it is infecting more countries with every passing year. And I think a global program for dengue control should be launched by World Health Organization. They are doing a lot on this scenario, but the need of celebrating the World Dengue Day and creating awareness to people about how to tackle this menace and how to address the issues which are there in different countries, because the scenario is different in every part of the world. Different problems are there, and how to address them, and what is the global action plan about dengue. We should all have meetings in which we discuss this, and what is the way forward, and how we can learn from each other experience and devise a mean to control this. And just like malaria, which is also a mosquito-borne disease, we've been able to eradicate it in some parts of the world. Then maybe one day we will be able to eradicate dengue from the world. But at this point in time, it looks very difficult because the number of cases are increasing with every passing day, and it seems very unlikely that we will be able to get rid of dengue anytime soon.
Well, so a mix of optimism and caution there. Thank you so much. I just wanted to apologize to Asghar Talbalagi. I know you've requested to speak. Unfortunately, we kind of ran out of time, but please, by all means, either share your comments on the chat function or definitely keep in touch with Dr. Iqtadar. I managed to upload very quickly here. Katia Teixeira Marquez, your paper just came out 4 days ago in PLOS NTD. So firstly, congratulations for that. And also, I'm just going to try and share a copy with all the attendees. So hopefully that's come up on your screens, and feel free to go ahead and download that. So in conclusion, Somia, you still have quite a few questions here that we did not have a chance to get round to, but perhaps I might be able to send those over to you and keep the conversations flowing. We definitely, this is what these Connect meetings are all about, is to kind of keep ensuring that everyone remains connected despite our current circumstances, and moving forward, even out of the lockdown situation, trying to keep us connected despite the distances and so forth. Somia has just shared her email on the chat function, saying thank you for your comments and feedback. Thank you, everyone. So please do go ahead. For our part, I would like to give you, Somia, again, a massive thank you for your time today.
You're talking to everyone and stuff.
So on that note, I'd like to wish you all well. Thanks again for tuning in. Thank you, Somia. And please keep safe and keep well. And hope to talk very soon again with everybody.
Thank you, Kamran, and thank you, Marianne, for it. Okay.
All right.